Hi, we're going to talk a little bit about obstructive sleep apnea. This is, to me, super fascinating. I didn't think much about sleep apnea. As a gynecologist, I knew about sleep apnea. I knew it had something to do with cardiovascular disease. But my sister just got diagnosed with sleep apnea, and I started doing some research, and I am just blown over. This is very much in my world. I didn't know that. And I want to share with you what I've learned and hopefully help a bunch of people. So an OBGYN hears the symptoms of sleep apnea all the time. I did not recognize it. We hear from women, I'm exhausted, I have no energy, I can't think straight, I can't pay attention, I can't remember anything, that's me. I can't sleep, I can't, I go to the bathroom all night, I can't lose weight. All these issues could be associated with sleep apnea. So what are the actual symptoms of sleep apnea? There's an excessive daytime sleepiness. A lot of times this is diagnosed by a partner with loud snoring. They might notice a pausing or gasping or choking during sleep. You can have irritability, a lack of focus or brain fog. We're going to talk more about menopausal brain fog. And could this be related to sleep apnea? Morning headaches, restless sleep with periods of being awake at night, getting up more than once a night to urinate, and maybe you don't have any symptoms, but you've been diagnosed with metabolic syndrome. Let's think sleep apnea. Let's think before we just treat all the metabolic syndrome, we should think about sleep apnea. Okay, so how does it work? So essentially, the back of the throat is a tube. And that tube is kept open during the day because we're talking and we're moving around and our muscles are firing and they're keeping the tube open. It just happens. But at night, all the muscles of the body relax, and that includes the muscles around the tube of the throat. Okay, so let's try it. Let's just try relaxing. Relax your eyes, relax your face, relax your throat and your neck. Let those shoulders lie down. You're going to close your mouth and then pull in with a breath with your nose plugged. I can't do it without my eyes kind of popping out because you feel the back of your throat closing in a little bit. Well, that is apnea. That's how apnea forms. Now, it doesn't work in everybody because not everybody has apnea. That's an over pull because we block the nose. But if you have apnea, a complete collapse is what is called apnea. A partial collapse is called a hypopnea. So it's not completely collapsed, but it's partially collapsed, and that can be a problem as well. Now, when you have that collapse, if it is a complete obstruction for 10 seconds, they call that an event. Okay, so that's an apneic event. So what? It actually is pretty important. When you breathe, your oxygen, you give your body oxygen and you get rid of carbon dioxide. But when you block that, your oxygen level goes down and your carbon dioxide level goes up. And this is really carbon dioxide driven. So the carbon dioxide receptors in your body, they're in the arteries in your body, they start sensing too much carbon dioxide and they say, hey, breathe harder. So what happens? You did that block. When you pulled in even harder, it closed even more. So it actually makes things worse. So at some point, the carbon dioxide sensors say, way too much carbon dioxide. Hey, brain, wake up. Okay. So it wakes you up. It's kind of shaking you, saying, wake up, give us that muscle tone. The muscle tone in your throat happens, the airway opens, you breathe again. Okay. But you don't actually wake up enough to know, like, hey, I'm awake, I'm breathing. it just kind of happens. So that might happen. If you have mild apnea, it could be between 5 and 14 times an hour. But if you have severe apnea, that is happening 30 times an hour. So 30 times an hour, your body is telling your brain, wake up. It's like sleeping with a bad partner who's poking you every 2 minutes. Can you imagine how poorly you would sleep? You might get a sensation of restless sleep or poor quality sleep. That's a very common sensation with sleep apnea. But how does that lead to heart disease? Well, what happens over the course of the night is the oxygen levels, which start out normal, start to drop slowly because with each apneic event, it can't clear all that carbon dioxide and get all that oxygen back to the level it started with. So over the night, it slowly goes down. So by the end of the night, your oxygen level can be quite low. That can damage cells in the heart. It may not affect the rest of the body quite as much, but the heart uses all the oxygen it's sent, and it's very sensitive because it's 100% efficient. It's very sensitive to a loss of oxygen. So the heart cells actually truly get damaged. Okay? It can also lead to high blood pressure. As those oxygen levels are dropping, your body pushes out blood pressure to compensate. And each apneic cycle, each apneic event causes a spike in blood pressure. It can even cause the heart to race a little bit. The blood vessels that are getting that blood pressure spike, they don't like the spike. It's kind of like getting hit on the head over and over. You don't really like that. So you're going to put on a helmet or build up your blood vessel walls to protect yourself from that constant blood pressure spike. So you actually get, we call it revascularization, meaning the blood vessels change in response to that blood pressure event. So when you wake up, your blood vessels don't go back to the way they were. They're still in protective mode. You can get true blood pressure, true hypertension from having sleep apnea and those blood pressure spikes. And by treating sleep apnea, you can actually reverse high blood pressure. It's amazing. Now, weight gain and diabetes control is a constant issue for women, particularly. I presume most of my audience is perimenopausal women like me. Sleep interference affects the hormone levels that are being produced that affect appetite and appetite suppression. So my niece was studying for the TEAS exam. It's an exam to help you get into nursing school. And we were pretty successful. We got her T-score up a little bit. And we came up with a little way to think about things. Ghrelin is a hormone that is produced and it makes you crave sweets and carbs. And we talked about how our stomach is a ghrelin. Because I've got so much ghrelin, I'm craving sweets and carbs. Now, the opposite is produced from good sleep, leptin. So leptin is a hormone that helps you feel satisfied with your meal. So you when you're getting close to being finished with your meal, your body says, hey, I'm satisfied. And we said if you had just slept in, you'd have a little more leptin and you would feel satisfied. So that's one way silly way we remembered it. But ghrelin is increased when you're not sleeping well, and leptin is decreased when you're not sleeping well. So it's a double whammy. The carbon dioxide that we talked about before affecting the blood pressure in the heart. The heart. That carbon dioxide actually increases your insulin resistance and can lead to higher blood sugars all day. And when you put them all together, we talk about the metabolic syndrome. A lot of people are being diagnosed with metabolic syndrome. That's blood sugar. That's cholesterol. Your good cholesterol goes down, your bad cholesterol goes up. your abdominal fat goes up. And we've talked about how abdominal fat is that metabolic fat, and your blood pressure goes up. All of these things are affected by the hormones of sleep. So it all goes together. Another thing that people get people who have sleep apnea get are morning headaches. So the brain is the most important organ in the body, or at least the body thinks so. So it does everything it can to protect the brain. If your oxygen levels are low, your blood vessels in your head are going to dilate, trying to get that oxygen to go up to the brain. Well, dilated blood vessels are related to headaches. That's how you get migraines. So it makes sense that in the morning, after you've had dilated blood vessels all night, you get morning headaches. So if you're waking up with a morning headache, think sleep apnea. You can also have irritability and inability to focus, depression, mood issues, and it's not sure yet. So sleep apnea research is really in its infancy. We're just learning more and more and more. It's not clear. Is it because you're being woken up hundreds of times a night every 2 minutes? Like that would make you kind of irritable. It could be affecting the brain cells, may even lead to permanent damage. We're not sure. But interestingly, in 2011, going back to 2011, there was a study that showed memory, attention, and critical thinking improved after 3 months on CPAP. So with about 2% of perimenopausal women having sleep apnea, and if they're right, it may be millions and millions and millions of people. Even if it's just 2%, that's millions of people, but they're thinking it may be even more, depending on how you define and who benefits from treatment, which we don't know yet, and we'll talk about in the treatment part. Could this be the answer to perimenopausal brain fog? I'm thinking maybe. We know that estrogen treatment does not improve perimenopausal brain fog. And it may be that treatment for sleep apnea, getting better oxygenation, not letting those carbon dioxide levels go up, not being awoken every 2 minutes, hey, that might be the answer right there. And I would love any researcher out there, pick this up and go. I'm going to work on it myself. Now, the other thing that's happening with sleep apnea that's really interesting is nocturia. Nocturia is another word for nighttime urination. Nocturnal, like nocturnal animals are up at night. Urination, nocturia, nighttime urination. So waking up once a night is completely normal. You usually do it about 4 hours into sleep. That is a normal thing, but you're supposed to actually conserve water at night. It works by a hormone called the antidiuretic hormone. A diuretic is something that makes you pee out. Antidiuretic, stop peeing out. And you don't want to have to get up all night to pee. So your body has come up with a mechanism to combat that for you. Well, what happens? It's a super complicated pathway. But if you're a medical nerd even more than me, please look it up. You can explain it to me. But essentially that antidiuretic hormone is turned off and you are literally making more urine. So you might feel like I am getting up 4 and 5 times a night to pee, and there's actually a lot more pee. And that is a real thing. It is not just that you're not sleeping well, so you get up and I'm not sleeping that well, I'll just get up, I'll change positions, whatever. No, you're actually making more urine. It is causing you to get up and have to urinate. So urogynecologists, take note. So if some of my urogyn buddies are listening, this is like really important information that I'm just making the association. I don't think it's really out there that much. So this is my Aunt Marty, and I've talked about my Aunt Marty, who she passed at 59 years old. She just terrible family history. And I really feel like if we had known more about sleep apnea, my aunt might have done much, much better. She had all the things. She had metabolic syndrome. She had the cholesterol. She had the diabetes. She had the high blood pressure. She had the weight issue. She had the sweets cravings. If in 1990 we had had information on sleep apnea, I can imagine that with some treatment, maybe we could have reversed some of this. Maybe we could have gotten, instead of dying at 59, maybe we could have died at 69, 79. Like maybe she would still be with us. So this hits really close to home for me. And I'm going to talk next about a little bit about diagnosis that's really done through your physician. And since a lot of my physician buddies will be listening to this, I'm going to talk a little bit about that. And then I'll talk about different modes of treatment and how they are effective and what we know about treatment. So thank you for listening. And next up, diagnosis and treatment. Someday I will know how to do this. But right now is not that day. So I turn off this crazy thing.